patients have to fight for access to biomarker testing. Some patients have to fight for access to, um, scans and different things or different therapies. But you had to fight just to get diagnosed with breast cancer. Tell us about your experience.
Yeah, thank you. So I am a non-standard case, and I feel it's very important that people are aware of non-standard cases. So what happened with me is back in 2021, we were still under pandemic restrictions. This is the first time uh, I got diagnosed. I started just to feel really exhausted, really unwell, and just weird, like something was up. Didn't really know what. So I went to my doctor saying, look, I feel really exhausted. She ran some blood tests. It didn't show it didn't show breast cancer, but it did show some weird things going on in my blood work, strange things that were going on. Um, and thankfully, she ran an enhanced blood panel. So she did the standard tests, but then she also ran additional tests, which is important because there was something flagged up there that she was really concerned about. And her words to me, which still ring in my head to this day, were look, I'm concerned you might have a cancer somewhere in your body. At that point, you're still thinking, no, it's not going to be that. Surely I just need some B12 or some iron or, something. It's going to be something else. But anyway, long story short, that kicked off a series of many weeks of going for tests on different body parts. Because if somebody says to you, you might have cancer, I mean, that's going to scare the life out of you, right?
You're doing every self check and Dr. Google search you can.
Yeah. And it's like, I was still like, well, yeah, I was just baffled. And around the same time, so I had a darling cat. She's crossed the Rainbow Bridge now. So my cat used to always climb up me and lie on my chest. And around the same time, she started pawing at me and pressing her nose right on my chest. So
Wow.
I remember saying to someone, yeah, this is like odd. I think I feel bad. So my cat was around 12 when this happened. And I feel bad, really guilty, because I said to someone, I think the cat's getting old and going a bit loopy because she's behaving really weird with me. Meanwhile, I'm going off for ultrasounds, and yeah, tests on different body parts. So no, that organ's fine, that organ's fine. And the weeks are going on. I'm feeling worse and worse. Um, the cat's still doing her thing. I then went for a like a well woman checkup, and my blood work is getting worse as the weeks are going on as well. When I went for the mammogram was normal, BRADS 2, which generally is nothing to be concerned about. When I went for the ultrasound, echography is referred to in Spain, but the technologist spent a long time going over the same area. And if I'll be completely honest here, that's when I knew
Hmm.
because that's the exact area that the cat was going to.
How long had the cat been like paying attention to that
So at
area?
this point, I'd had my cat. She was a rescue cat, and she ended up saving my life actually. So by now it was probably about 7 weeks, 7, 8 weeks. But as the time was going on, she was getting more insistent, like every morning, every night, and
Wow.
panicking. Yeah. So I'm feeling worse. My blood tests are getting worse. I've gone to this hospital for this well woman check, and I'm not getting any sensible answers from the consultant that I was seeing. She was throwing all kinds of stuff at me. Now, I had no classic symptoms of breast cancer. I had no lump that could be seen or felt. I had no skin changes. So I had none of the typical symptoms other than my cat going there, feeling exhausted, feeling unwell. And there's something called a CA125 tumour marker that was elevated. Now, that's normally associated with gynecological cancers, but it can, in some cases, be associated with breast cancer. Not often, but it can. So I said to the consultant, look, I'm concerned because this tumour marker is going up. I'm feeling worse. The ultrasound was rated as BRADS 3. which again is no cause for concern. But they did say there was a solid nodule. So I asked for a biopsy to be done or an MRI to be done, and I was told no. um, we're not going to do that.
Why
Come
did they
back in
say no? They didn't want to biopsy it. Did they have a reason?
because they had rated it BIRADS 3, and as per the policy, you get referred for biopsies if you're BIRADS 4 and above. And they
Okay.
classified it at BIRADS 3, where I started to discover all about guidelines and protocols and all this fun stuff, right? So I again asked, got declined. Consultant was actually quite rude. She actually had a go at me for organising additional scans that I was doing. So I actually ended up abandoning that appointment at one point because I wasn't getting anywhere. By this point, I did actually have chest pain, like a stabbing pain. There's a lot of myths and misconceptions around breast cancer. One of them is, this actually comes from the medical field as well, is that it's not painful. So I said to this consultant, look, I'm getting a stabbing pain in my chest now. She's like, oh, it's your hormone. And at this point, I was 43 years old. So I said, look, I'm 43 years old. I've never had a stabbing pain in my chest before. Like, this isn't, I know my body. This is not my hormones. Something else is going on. I couldn't get anywhere with her, couldn't get anywhere. So I abandoned the appointment. Do you know what people are like? People are like, well, your mammogram's clear, your ultrasound's clear. But I knew by then something was wrong because I would just, again, wasn't feeling well. The cat was still doing her thing. Went home that night and the cat, again, same thing. So I thought, you know what? Okay, I'm just going to book myself an MRI. So went off, did some research on the internet, found this amazing MRI diagnostic centre in a local town run by Executive Health Marbella. And I was able to go there for an MRI. And the chief physician that runs the centre, he really listened to me and took on board my concerns. So he's like, yeah, of course, give you an MRI. So I went in for the MRI. There it was, the exact spot the cat had been going to. Had a biopsy organised within a week. Went for the biopsy. That's something I had to pay for the biopsy. Had it confirmed. I've had really polarizing experiences. So I had what I deem a negative experience with that one consultant, which I never went back to. Dr. Reinhard, that runs this centre, was absolutely fantastic. I mean, he was chasing my biopsy result whilst he was on his personal holiday with his family. Now, this was in the summer of 2021. And out here, so I'm based in Spain, a lot of facilities will close down or go on to skeleton staff in August because it's the hottest month of the year. So by him chasing up my biopsy result, going above and beyond in his personal holiday, it meant I could then get into surgery before the August or summer shutdown. Otherwise, I would have had a delay of 4 to 6 weeks.
Mm.
So I'm super thankful for that. So it's been really contrasting experiences. So that's how it got found the first time.
Well,
So I was 43 years old.
wow. So what a day and night experience.